Hi, it's time for Good Energy, and I'm Dr. Julie, and welcome to Bodyful Day 377. This is day 6 on the series of Dentist and the Senses, and we're talking about how to get good energy in after or while being at the dentist from the vestibular sense. Now, before we jump into that, let's start with the basics. Go ahead and take a deep breath in and release. Deep breath in, expand in the belly, expand in the chest, expand up into the head, and release. And today we're talking about the vestibular sense. So we're talking about dizziness, a little bit of headache sometimes that can come with vestibular issues, and maybe a little nausea. So if you've ever, sounds like a regular trip to the dentist to me. If you've ever been to the dentist and end up coming out with a headache, nausea, and dizziness, go ahead and take a deep breath into it. And release. So this series, remember, is how to have energy to heal from a visit to the dentist where there are lots of stressors. Very, very few times, if we're actually going to get a procedure done, is there no stressor. And good energy in, we want to get good energy in is where we can find it. Interestingly, the dental industry profession has been adapting a lot of their stuff to create sensory good energy in. And we're going to talk about how that comes up in the vestibular sense. So let's think about what we know about the vestibular sense. So we've been talking about the vestibular sense for over a year now. It is the sense of balance. It is a sense of where you are in relationship to G-forces. It comes from three key places. Proprioception, or kinesthetic sense, from your ankles, hips, neck, and jaw. It comes from your visual system, so what you are seeing, and it also comes from your semicircular canals, which are kind of located up in there. And your semicircular canals are designed to tell you about forces and about where you are in relationship to gravity. Your visual system obviously tells you where the horizon is and where you are looking up and down. And your joints, your jaw, your neck, your hips, and your ankles give you a little bit more indication about where you are based on, like, if your feet are flexed versus pointing up or pointing down. That kind of tells you what the surface is like and how to keep yourself upright in relationship to the ground. Now, what's interesting about going to the dentist, even if you're just going in for cleaning, you are holding your jaw open for a period of time. And as a chiropractor, I've always seen, especially in my past life where I was in my my previous practice that I had was more of a sports-based practice. And in that practice, I had kids that were state level track athletes and state level cross country athletes. So I had a lot of runners. And I had high schoolers that were completely kitted out with braces. And they had lots of stuff in there. And they would get their braces tuned, tightened, shifted, whatever that brace thing is. I never had braces. And what would happen would be that they would not feel as stable while running, or they would feel like they could start to feel like they were pulling muscles in their legs and in their back while they were running. And they couldn't figure out why. Well, one of the features is that when your jaw has been held open or when your mouth has been messed with, like your braces have been tuned, there is different information coming into your vestibular system from your jaw. So yesterday we talked about the kinesthetic sense and how you can end up with neck pain, shoulder pain, headaches, jaw pain, and eye pain from having a procedure done where you have to hold open your jaw for a long period of time. Well, when you do that as well, whether it be because you're getting your braces tuned up or because you had a dental procedure, your balance is not going to be the same as it was before you went in, because your jaw and the muscles in your jaw are contributing to your sense of balance when you are moving around. So how do you work on that? How do you work on that? Well, interestingly enough, you can go back to that kinesthetic sense. You can go back to massaging the muscles around your jaw. You can also go ahead and massage the muscles around your head, and that will actually return your jaw to its normal up and down status and may help your body reintegrate the correct sources of information. So dizziness, nausea, and instability are all par for the course when you get a lot of dental work done. And it may sound absolutely silly, but it is what happens. And unfortunately, when we think about what has dentistry done to move stressors into good energy, and this is not one thing that they can move. You need to hold your mouth open for a certain amount of time, unless they get procedures that can be done while your mouth is closed. They're kind of out of luck, which means that you too are out of luck for good energy and while you're in the office for the vestibular sense. Now, the other component of the vestibular sense is the fact that the chair does go backwards, so that you are laying essentially flat so that they can look in your mouth at a better angle and see more things and get things accomplished better, because instead of being up here, you are down here. If we think about even back in the 90s, when we think about dentistry was done a little bit up higher. It was done where your mouth you weren't totally extended backwards. And what that did was that put a lot of stressors on the dentist. And you may be thinking, well, I don't want those stressors. But honestly, having your dentist put your chair back further means that they're going to end up with less repetitive motion issues, and they're not going to be working here in your mouth. You actually want them working right down here in your mouth. But unfortunately, that means that you have to recline. And when you recline, if you have issues with BPPV, benign paroxysmal positional vertigo, I may have gotten my two P's mixed up. If you have an issue with dizziness, sometimes going flat like that can actually trigger a dizzy spell. Now, the good thing for you is that if you tell your dentist beforehand, hey, I have some issues with dizziness and vertigo, they don't have to put the chair back. It's just that for you, they are going to be a little cramped working a little higher. But we're trying to get the balance between having to work on patients here all the time and having them have repetitive injury and you having to deal with the stressor of vertigo. As long as you tell them, you're reducing your stressors and getting a little bit better good energy in. So today, what we know about the vestibular system and dentistry is that if you tell your dentist that you're prone to vertigo, they don't have to put the chair back as far as they did. They may have to stand up to do their work, but you will less likely to get vertigo. But also we know that when you are opening your jaw for a long period of time, you are at increasing the amount of stress on the vestibular system, because you're distorting how your mouth opens and closes, and you're putting stress and strain on those muscles that open and close your mouth, which means you may be dizzy. You may not have as a fluid, if you are a runner, if you are in sports, you may not have as fluid a stride that you did before you went to the dentist. So make sure you look back at yesterday's video and look at how to work through these muscles around your head so that you can get your jaw back into its normal position and have better stride and better balance. I hope you are having a great day. Meet me back here tomorrow where we cover the sense of touch. So clearly dentistry involves the sense of touch, and it is a big stressor. So we're going to figure out how you can balance that out yourself. All right, let's finish it off. Take a deep breath in and release. Have a great day.